Thank you, Ariel. So I'll talk a little bit more about the key ideas that I mentioned at the beginning. So just go into details a little bit. So evidence-based policy making, what is it? Simply put, you can understand it is a process that utilizes evidence from research to inform the policy making process. So in the last few decades, evidence-based policy making has become a very important topic in the conversations among research organizations and government departments. In the United States, there are a lot of writings about the role of evidence-based policy making as a valuable tool to policymakers to cut down on budget, to make government spending a little bit more effective. And these are only two quotes from many writings that we came across in our literature review. They come from the Brookings Institution and the Heritage Foundation. But more than that, though, evidence-based policy making can be used to improve a lot of other aspects in the nation. So the example that I gave at the beginning was an application of evidence-based policy making in the field of public health. And that project was supported and implemented by a research organization in Canada. Then in the UK, the government was also very keen on the idea of evidence-based policy making. And two tools that you might be familiar with are the Agenda Book and the Green Book implemented by the UK government. Then in the US, the Obama administration has implemented and developed 6 evidence-based initiatives. They cover a variety of aspects in social interventions, from teen pregnancy intervention to home visiting program to the improvement of K-12 education. And so we can see that evidence-based policy making can do a lot of good out there. And it has also been pretty popular. So what is the appeal? What are the advantages? Why do people use evidence-based policy making? Well, it turns out that evidence-based policy making's advantage lies primarily in its logical approach to policy making. Well, that is something that made evidence-based policy making unique and better than the old ideology-driven approach to policy making. And according to the literature, the advantage of EBP could be broken down in 3 different aspects: the social benefit, the economic benefit, and the fiscal benefit. So I'll explain a little bit more about these different types of benefits of EBP. So the social benefit could be achieved by evaluating different social programs. So there are a lot of social programs out there. Some of them are effective, some of them don't really work very well. If we have a way to evaluate them in a rigorous way, then we can expand the programs that work and cut down the programs that don't work. So if you expand the programs that work, that would bring about significant social benefits. For example, reduction in teen pregnancy, maybe improvement in K-12 education, improvement in maternal and child health, that kind of thing. Then the economic benefit is achieved by cutting down programs that don't work and again expanding programs that work. I'll give you an example. If we invest in programs that could close the achievement gap between children from low-income background and children from high-income background, we tap the untapped human potential, and that could bring about a lot of significant economic results. Then the last benefit is the fiscal benefit, and I think I touched a little bit on that earlier. If we cut down programs that don't work, we improve the allocation of resources. In the long run, that reduces debt, and I think we can all agree that it's a good thing. So we're mainly interested in countries in transition. So what is the application of EBP in countries in transition? A lot of the discussion that we've had so far about evidence-based policy making can also be applied to developing countries. And a lot of the strategies of EBP in developed countries could also be applied to developing countries. The advantage is that EBP is usually not well developed in developing countries. So if you start to develop that, the potential for growth would be a lot greater. What about the challenges? There are many challenges, but one challenge that repeatedly came up in our literature review is the idea of political instability and conflict. So for example, the Syrian civil war started in 2011. It's been going on for about 5 years now. And during that period, there has been a huge displacement of the population, and there were many acts of violations of human rights. And in that context, it would be pretty difficult to develop evidence-based policy making to its fullest. So that's one major setback in developing countries. And there are other major challenges out there. Now, I will talk about the second key idea of our research, and that is data visualization. There are many definitions of data visualization out there, and this is probably the best known definition of data visualization dating back to the 1999. Simply put, data visualization could be understood as the use of electronic tools to promote accurate understanding of the data. And so I think that under that definition, the role of data visualization is actually twofold. The first goal of data visualization is to help the audience understand the data better. Then the second goal is for the researchers to be able to communicate their messages to their audience, whatever that message might be. I'm going to talk a little bit about the principles of data visualization, and some of these ideas actually mentioned in an article by Stephen Few, and the title is up there actually in the caption of the picture. The title is Information Visualization, Design in the Arts, and if you're interested, you can look into this article. And I will open that with an example of a data visualization of medical cost by a member of Steve Media Group. So this is kind of unusual. It is an unusual pie chart. It displays as many as 5 different variables: the name of the disease, so depression in this case, the age of the patient, so in this case age 45, then the number of patients of that age with that disease, in this case 780, then the average yearly health care cost for patients of that age with that disease. In this case, we have 4,454. And then lastly, the breakdown of the cost to the insurance company and the patient. And so we have 3,552 and 901. So Few's argument about this data visualization is that the human mind has trouble comparing radius to radius and then comparing angle to angle or area to area. It's pretty difficult for us to compare. For example, the area of the slice that is in green and the slice that is in purple. It's difficult for the mind to kind of grasp that. And beyond that, we think that there are 2 other aspects of this data visualization that could be improved. There are too many variables being displayed. It's a little bit hard for the viewer to grasp. The second thing is that if I'm interested in a trend, for example, if I'm interested in the average healthcare cost for patients between the age of 1 to the age of 89, there's not really any way for me to look at that with this visualization. So I'm not bringing this up to criticize the author, I'm just bringing it up as an example of a data visualization that could be improved by applying a few principles of data visualization that I'm going to talk about next. So the first principle is that if you have numbers that you want to display, then maybe it's best to use the lengths of simple 2-dimensional objects. An example of that are bars and lengths that connect dots. And the reason for that is that if you look at bars, if you look at lines, your mind have to compare 1-dimensional objects in a 2-dimensional plane, and that's easy to do. Now, if you present the audience with angles and areas, they have to compare 2-dimensional objects in a 2-dimensional plane, and that's more difficult to do. So one example of this principle is a visualization of the presence of TB in North Korea from the globaleconomy.com, and it's a simple visualization. It's just a bar graph, but it draws our attention to the simple increased trend of the presence of TB in North Korea. And we can see that it's been on the rise since about 2007. So it's simple, but it get the job done. And the second principle is that viewers, the audience, they cannot see a pattern formed by multiple values if they only look at one value at a time. So how do we overcome that? We overcome that with lines. And this is an example. It's actually a snapshot of the animation showing the temperatures from Bloomberg.com. And there are two things going on here. The first thing is that each line shows a year. And the line on top, actually the bold red line on top on the screen there, is the temperature for the year 2015. And what it means is that we look at this visualization, we can see very quickly that the temperature for the year 2015 has been the highest since 1880. So that was the first thing. And the second thing is that if you look at each individual year, so for example, if I'm interested in the year of 2015, I can see the pattern of the temperature for that year quite well. And by the way, this visualization is looking at the temperature in comparison to the average of the 20th century, which is why November and December have higher temperatures, because they are higher than the average. So they're not comparing temperatures of November and December to June or July, but to other Novembers and Decembers in other years. And we can see clearly that the temperature in the winter have been higher than the average of the 20th century. And the third principle is that if you have multiple ideas that you're trying to display in multiple countries, as in this example, showing multiple graphs could be a better way of doing it. And this is an example of the cumulative asylum applications from 2011 to 2015 from LAtimes.com. It's only an extract, but we can see pretty easily that Germany is the country that has had the highest number of asylum applications during that time. It's easy, it jumps out at us. And the last principle is that the audience should be able to focus on the data that they are interested in. And this is an example that compares North Korea and South Korea from TheGuardian.com. There are actually quite a few variables here. The one that is being displayed right now is the population, and then going down along the circle here we have GDP, infant mortality, internet user, age, and so on. So if a user is interested in looking at GDP, then he or she should be able to just look at the GDP and not be distracted by the other variables. And that's the key idea of the last principle. So I have talked quite a bit about data visualization in general. But there's another kind of category of data visualization in there that is quite interesting. It is interactive data visualization. And you probably have seen that a lot. So what is the appeal of that? So let's look at this picture. What comes to your mind when you first look at the picture? Maybe you think about youth, maybe you think about joy, maybe you think boy, because we have a boy here. Maybe you think about sports or play, because the boy is holding a ball. The point is, whatever first comes to your mind when you look at this picture, it comes to you easily. It doesn't require a lot of effort, it just comes to you. And that is an example of what psychologists call system one of the human mind. How about this? If you look at it, at first glance, you know it's a multiplication problem. You probably know that you would know the answer to this problem. You probably know that you would be able to solve it. Maybe with pencil and paper, maybe without pencil and paper. But at first glance, you probably don't know the exact answer to this problem, just at first glance. But you probably will know that just after a minute or so. And so the point is that later on, when you sit down and you actually work out this problem with pencil and paper, or maybe without, then that is when your system 2 is at work. And so the examples that I just presented are actually pretty well-known examples in psychology research. And they represent the idea that the human mind is made up of two systems, system 1 and system 2. System 1 is called fast thinking, it's intuitive. It doesn't require a lot of effort, it just comes to you. System 2 is called slow thinking. It demands more effort. It's slower, but it relies on careful and analytical thinking. But what does that have to do with interactive data visualization? Well, it turns out that when you present someone with something that they can play with, then their system too is engaged. So if I present an interactive data visualization that requires my audience to kind of play with it, maybe choose a few variables, maybe clicking around, maybe zooming in, then that asks for their system to be engaged. And because of that, they better understand the data. And as a researcher, my goal would be accomplished. So that was the ideas about data visualization and evidence-based policy making. I will now turn over to our panelists so that they can present the exciting part of the presentation, the demonstration of data visualizations.